When it comes to treating mesothelioma, radiation therapy is less commonly used than chemotherapy or surgery, but it still can play important roles in treatment. Radiation can relieve symptoms, prevent complications, and in some cases might help control the spread of the disease. Today, I want to explain exactly how radiation therapy works for mesothelioma, when it's used, what the procedures involve, what side effects to expect, and whether it actually improves outcomes. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding radiation therapy helps you make informed decisions if it's recommended. So let's start with how radiation therapy works. Radiation uses high-energy beams, usually X-rays or protons, to damage DNA and cancer cells. When those energy sources are applied, they damage cells so they can't divide, and eventually they die. Normal cells can be affected, but they're generally better at repairing radiation damage than cancer cells are. For mesothelioma, radiation is challenging because the disease spreads over large surface areas, the entire pleura or peritoneum. Delivering radiation to such large areas while still protecting vital organs like the heart, lungs, liver, and kidneys, it's tough. That's why radiation is rarely used as the primary treatment for mesothelioma. Instead, it's used in specific situations where it can provide targeted benefit. The main uses of radiation for mesothelioma are palliative radiation to relieve pain or other symptoms, prophylactic radiation to prevent tumor growth along procedure tracts, adjuvant radiation after surgery in carefully selected cases, and emerging techniques like intensity-modulated radiation therapy and protein beam therapy that allow more precise targeting. Now, before I get into more detail, I want to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, taking a closer look at the different applications I mentioned before, palliative radiation is the most common use of radiation therapy. If mesothelioma tumors are causing pain in the chest wall, in bones, in the nerves from tumors pressing on them, radiation can shrink tumors and provide relief. It doesn't cure the disease, but it significantly improves the quality of life. Radiation can also relieve breathlessness if tumors are compressing airways. It can address coughing from airway irritation, and can alleviate difficulty swallowing if tumors are affecting the esophagus. Palliative radiation involves targeted treatment to specific painful or symptomatic areas rather than the entire area that the disease is affecting. Treatment might last 1 to 3 weeks with daily sessions. Now, prophylactic radiation is given to procedure tracts to prevent what's known as tumor seeding. When biopsies are performed or chest tubes are placed, there's a real concern that cancer cells could track along the needle or tube tract and grow in the chest wall. This can cause painful lumps along the procedure sites. And because of this, some centers do give radiation to biopsy sites and chest tube insertion sites to prevent this. Treatment is usually a single session or a few sessions that specifically target that tract area. The evidence for this, it's mixed. Some studies show benefits, others don't. Practices vary between centers, so you might want to ask your physician whether this is something that your treatment facility does. Adjuvant radiation, which is after surgery, might be used in selected patients who have undergone pleurectomy, decortication, or extrapleural pneumonectomy. The theory behind doing this is that radiation can kill microscopic cancer cells that are left behind after the surgery. But again, the evidence in support of doing this is weak, and delivering adequate radiation to the entire surgical area without damaging vital organs is challenging. In fact, hemithoracic radiation, which is treating the entire affected half of the chest, was studied in the past and was found to cause severe lung damage, so it's no longer commonly used. Newer radiation techniques offer more promise. Intensity modulated radiation therapy, or IMRT, uses computer-controlled radiation beams that can conform to complex tumor shapes and vary intensity across the treatment area. This allows higher doses to be administered to the tumor while reducing exposure to normal healthy tissue. IMRT is being studied for mesothelioma, particularly after lung-sparing surgery. Early results suggest it might be feasible and have an acceptable level of toxicity, but the long-term benefit data is still emerging. Protein beam therapy uses protons instead of X-rays. They deposit most of their energy at a specific depth and then stop, where X-rays pass through the body. This theoretically allows more precise targeting with less damage to tissues other than the tumor. As is true of IMRT, protein therapy is still being studied for mesothelioma, and it remains experimental. It's only available at specialized centers, and it is very expensive. So, what does radiation treatment involve practically? You'll start with a planning session where CT scans are performed to map exactly where radiation should be delivered. Custom molds or masks might be created to make sure that you're positioned in the exact same way each time, and tiny tattoos, which are permanent ink dots, are placed on your skin to help align the radiation equipment the same way each time. Treatment sessions are generally Monday through Friday and typically go on for 1 to 6 weeks, depending on the goal and the dose. Each session just takes 10 to 20 minutes, and most of that's setup time. The actual radiation delivery only takes a few minutes. You lay still on a table while the radiation machine rotates around you, delivering beams from different angles. You won't feel anything during radiation. There is no pain. Side effects? They depend on what area is being treated and the radiation dose. For chest radiation, common side effects include fatigue that worsens through treatment and lasts for weeks after finishing. Skin irritation like sunburn in the treatment area, esophagitis, which is inflammation of the esophagus causing painful swallowing if radiation hits the esophagus, and pneumonitis, which is radiation inflammation of the lung, and it can cause cough and breathlessness. Long-term effects can include lung scarring, heart damage if the heart is in the radiation field, and an increased risk of secondary cancers in the radiation area years later. So that's a lot. Does radiation improve survival in mesothelioma? For palliative radiation, the goal is not to extend survival, it's to relieve symptoms. It's effective for this purpose in many patients. For adjuvant radiation after surgery, the evidence of survival benefit is weak. Some small studies suggest a possible benefit, but large randomized trials have not shown clear improvement. The challenge is in delivering adequate radiation doses to eliminate all the cancer cells without causing unacceptable damage to the vital organs. The large, diffuse nature of mesothelioma makes this very difficult with the current technology. Now, peritoneal mesothelioma specifically, radiation is rarely used because the abdomen contains so many radiation-sensitive organs, and widespread peritoneal disease can't be adequately treated with radiation without causing severe toxicity to those organs. So, should you ask about radiation if you have mesothelioma? If you're experiencing pain or other symptoms from specific tumor locations, go ahead and ask whether palliative radiation could help. If you've had biopsies or procedures and you develop painful lumps along the procedure tracts, ask about radiation to treat these. And if you're considering or have had surgery, Ask whether adjuvant radiation might be appropriate for your situation. One way or another, you need to understand that radiation won't cure your mesothelioma, but it can provide meaningful symptom relief and quality of life improvement if it's used appropriately. So, to review, radiation therapy for mesothelioma is used mainly for palliative purposes to relieve pain and symptoms from specific tumor locations. It can prevent tumor seeding along procedure tracts, and sometimes it can be used as adjuvant treatment after surgery, though the survival benefit from this is unclear. Newer techniques like IMRT and protein therapy allow more precise targeting, but they're still largely investigational. Side effects include fatigue, skin irritation, and potential organ damage in the radiation field. The bottom line is that properly administered radiation can meaningfully improve your quality of life through symptom relief. You can visit mesothelioma.net for more information about radiation therapy and symptom management, or call our patient advocates at 1-800-692-8608 to get more immediate information. You can also use the live chat feature on our website. As for me, remember to post your questions below, and I'll see you next time.